sounds like we can get going. Thank you, everyone, so much for being here. My name is Leah Raff. I'm with the DPS Substance Use Prevention Program. Um, as many of you know, we host a webinar every month, and this month, it's been a year. I'm so excited to have Scott LoMurray here. Scott is the CEO of Sources of Strength. Which is one of my favorite programs that we get to use in DPS. And Scott, I had your whole bio put up, but now I have too many screens going, so I'm just going to let you get started.
No worries, no worries. Thank you, Leah, for having me, and thank you, everybody who's either online with us live right now or is going to be watching and joining later. I'm excited to be able to be here and share just a little bit about sources of strength. And so, kind of my goal and my hope for our time together today is just to give you a little bit of an overview of what is sources of strength and some of kind of the philosophy and the vision behind the model, as well as a little bit of how it really kind of works, within a school, and then share some of the research and the evidence base. And we're really excited. We just had some new research published that came out this year on the efficacy of sources of strength. And so excited to share that with you all. And then I'll try to leave plenty of time at the end to answer any questions that folks might have, and we'll kind of go from there. And so we can get started with that first slide. And if you've been around sources of strength, or you've been around the field of prevention, sources of strength is often named as a suicide prevention program. As we'll discuss, it's a lot more than that. But if you've been around the field, you might have heard this parable about a woman who lives in a village situated near a waterfall. And every day she takes a walk along the water's edge. And one day she hears a shout and she sees somebody caught up in the current about to go over the waterfall. And so she dives in there, she swims out, pulls them to safety, ends up doing CPR and saves this person's life. And it's this really heroic thing. And the next day, she's taken on a walk along the river's edge again, and she hears another shout. She sees another person caught up in the current. She dives in, pulls them to safety, and as she gets them to shore, she hears another shout. And they start to realize there's all these people caught up in the current, about to go over the waterfall. So they get organized and they build watchtowers, and they train lifeguards, and they train the entire community in CPR. And they really mobilize around supporting people who are in this kind of moment of crisis, and they're able to save a lot of lives. But unfortunately, they're not able to save everybody. And one day the woman starts walking upstream. The people say, where are you going? We need you here. It's all hands on deck. And she says, well, I'm going to go see if I can keep some people from falling in the river. And that's really what we mean when we talk about upstream prevention. And you can go to that next slide, Leah, of the model of oftentimes, sorry, one more back. A lot of times when people are talking about suicide prevention, they're really talking about intervention. They're talking about identifying somebody who's in crisis and trying to get them to the proper mental health referral. And so it's sort of these waterfalls edge strategies. And that's obviously really incredibly important work. And that's absolutely a component of what we do at Sources of Strength. But we felt really strongly that that wasn't a comprehensive model for what prevention can look like. And that we really need to have a focus on what are we doing to prevent the onset of that crisis? How are we helping keeping people out of the river much earlier on? How are we helping people get back out while the waters are a little more tranquil? And so that's our primary focus and our primary vision, and really kind of the genesis and the founding of Sources of Strength was out of that, was seeing that so much of what we were doing was really reactionary and it was really crisis driven. And we felt like we could do a lot more to get ahead of that issue. And so really thinking about how are we increasing protective factors in people's lives? How are we increasing healthy coping strategies and resiliency? How are we increasing belonging and connectedness, and these things that we know help people get connected and to help people to be able to be well, and shifting norms around help seeking, that asking for help is a sign of courage and strength, that getting help from an adult, that adult could actually be helpful and not just complicate things. And so when we can move upstream and build up these protective factors and build up this wellness, it really can have these downstream outcomes. And that's really at Sources of Strength. Our vision is really to empower a well world. And that's that next slide there, that really focusing on wellness is the goal. And prevention really results in outcomes of that goal. That when we can increase health, when we can increase wellness, when we can increase these protective factors, these leading causes of life, that we are then going to prevent some of these downstream factors, and that's really what Sources of Strength is focused on. And you can go ahead and go to the next slide there. And yeah, again, that focus really on health and on wellness being the goal and being what we're working on at Sources of Strength at both the individual level, but also at the community level and at the cultural level of how do we create environments of well-being that are protective for folks. And that's really where we're spending the bulk of our time and our attention. And then what we're finding is that also really has downstream outcomes around improving our ability to intervene and get people connected to help when those help-seeking norms are shifting, when that connectedness is shifting, that we're much more able to connect people to the help that they need and deserve when they are struggling, and make sure that we're getting them that support. And then also that we know when we have kind of those waterfall issues that can look a lot of different ways, right? That it might be a suicide attempt, it might be drug abuse, and it might be violence. There's lots of different ways that can show up. And by moving upstream, we're able to have an impact on all of those different things. But also when a community does experience a loss, does experience some difficulty, that this is a model that really helps us move through that difficulty in a way that's healing, in a way that helps the community to move through that. And we know that effective postvention is effective prevention. That the way we respond after we've had a loss really matters. And this is a model that really helps us do that. And so we end up having a much more kind of comprehensive approach to prevention. And so you can go ahead, Leah, and maybe skip. Why don't you go ahead and skip a couple slides, because this one has a lot of transitions, and I apologize for some reason. Yeah, we'll stop there. I'm sorry, one back. Apologies, everyone, when the slide deck wasn't working on my end, so Leah's helping me out. And so Sources of Strength, as we build Sources of Strength, it's been around now for 27 years. And so this is a really proven model that started out really kind of as a grassroots program, and now has become one of the most rigorously evaluated and widely disseminated prevention programs in the country. And as we were building it, we were trying to really meet some of the gaps that we were seeing in the prevention space. And one of those was that a lot of what was happening was really risk focused. And some of the strategies was to kind of come in and talk to young people about risk factors and warning signs and what to look out for if somebody was struggling. And our experience when we went into a group of teenagers and we asked, what are the risk factors for suicide? They could just kind of fire those off, no problem. But when we asked them, how does somebody who's suicidal get better? How does somebody who's addicted to drugs or alcohol recover? How does somebody who's experienced abuse or harassment or violence, how do they get through that? And it was kind of crickets. And we realized there's a lot of dialogue happening about what risk looks like, but not nearly enough conversation happening around what strength looks like, what recovery looks like, what resiliency looks like, what connection looks like. And we have to be telling those stories. And so that was a big part of the model, is really trying to say, how do we not come in and just talk to a community or an individual about all the risks that they have, but come in with an asset-based approach of talking about the strengths, talking about the things that help us weather those ups and downs and twists and turns that life can throw our way. And then one of the other things that we're seeing in the prevention field, I think prevention writ large and suicide prevention in particular has kind of been stuck within, I would say, an unhelpful paradigm of kind of sad shock trauma messaging. So it's a lot of sad imagery, it's a lot of shocking statistics, and it's a lot of traumatic stories. And what we were finding is that was actually causing a false normalization effect, making the very thing that we're trying to prevent seem more common than it truly was. And so when we use a statistic like suicide being the second leading cause of death for young people, that's an accurate statistic, but it's also a misleading statistic, because not that many things kill young people. They're not dying of coronary heart disease. So suicide comes up on the list, even though they're dying at lower rates than the middle-aged population. And so the way we talk about it really matters. And when we look at the data, what it shows us, that depending on kind of where you are in the country, it's something like 1 in 10, 1 in 12 students reports considering suicide. And I think, I'm sorry, like 1 in 6, maybe that stat was, I'm getting them flip-flopped in my mind. And then like 1 in 10, 1 in 12 report making an attempt. And those are really shockingly high statistics. But when we look at the data around dying by suicide, it's roughly 1 in 10,000. And that number is far too high. This is a public health crisis in our country. But what those statistics tell me is that statistic can be misleading, because what it tells me is that the vast majority of people who struggle with feeling suicidal do not go on to die by suicide. That recovery and resiliency and connection is the true norm. But that's not what happens when we just throw out those statistics, or we put infographics of the number of suicidal students in a school. And so we really wanted to shift that strategy to talking about hope and help and strength, and to telling those stories of connection and recovery, and really normalizing those help-seeking pathways. And that's what we've seen to be a really powerful component of this effort. And then the last gap is that, a lot of what was happening there's a lot of quote unquote teen suicide prevention happening without any teenagers involved. And we felt really strongly, if we're going to move the needle in a high school, we need high school students involved, that their voice is absolutely critical. And that's a key component of what we were doing. And so bringing in that peer-led component, that their voice is really what's going to create that change. And then on the next slide there, you can see this is more of our elementary model of bridging the gaps. And so that vision to move upstream really led us to develop out an elementary program where we're thinking about how do we cultivate these strengths and these protective factors, these skill sets, this culture around trust and connection and belonging. How do we do that at an earlier age? And what kind of protective influence might that have? And so that led us to designing and building out an elementary model, which takes a different strategy. It's a different approach in terms of the kind of pure leadership model at the secondary level versus more of a classroom-based curriculum at the elementary level. And then making sure, obviously, that we're using age-appropriate concepts and terms, but really focused on still empowering student voice, focusing on strengths, focusing on protective factors, and building healthy culture, and creating connection between youth and adults, and all of those really kind of core components that really bleed into both of those models. And then you can go ahead and skip to that next one. And that's the idea, again, of moving upstream is really also informed by this concept of kind of shared risk and protective factors, that we know the risk factors for suicide are not unique from the risk factors for violence or substance abuse or having a mental health issue, that these have shared risk factors and they also have shared protective factors. And so that really leads us to that idea that, and this next slide of moving upstream is really a rising tide that lifts all boats, that moving towards wellness creates the conditions that prevent a whole host of these different kind of adverse outcomes that we're fighting. And we have, I think, a siloed prevention model in the United States. We have really siloed funding for these kinds of things. And so much of the energy and the effort is happening on kind of that crisis intervention response, when we need a little bit more parity around how do we move upstream and really create those conditions for health and well-being. And so, Leah, this next one, again, you can kind of skip through right there. And so just quickly, this is the source of strength model at the secondary level, taking a group of caring, connected, and positive adult advisors and partnering them with a representative group of peer leaders from that school. And we really feel like one without the other lacks prevention power, that if we just come in and train adults, we're not going to move the needle in the way we need to. If we just come in and train students, we're not going to be able to have the impact that we can have when we partner students and adults working together. So we have a really great, engaging training that kind of serves as a launching point. It's really fun. It's really interactive. We're tapping into these strengths and protective factors in our life, talking about what that looks like in our world, and then really having some time to focus on how can we how can we use our voice? How can I use my influence to create change and to create an impact in the school, and doing some brainstorming around these strategic messaging campaigns. And then the team continues to meet and work together over the duration of the school year, over the duration of multiple years, that this is not a one-time assembly style model, but it's really, it's the Sources of Strength program is much more like exercise than it is like an inoculation. It's actually about cultivating and continuing to do the work to create a community of strength, to create these conditions for health and well-being. And so that team continues to meet and work together and engages in engaging the broader population in these public health messaging campaigns, to invite people into that. And that creates this kind of positive culture change, positive social norming, where we start to actually see these health norms change and spread across a population, across a school environment. And then the next slide there kind of just shows the elementary model. Again, it's more curriculum based at the classroom level, but we also really feel like that adult component is really important. And we know that our teachers, our educators are struggling as well, that this is not content for young people, this is content for all people. And so a big component of the model is also promoting staff wellness and staff health, and helping staff think about, what does this look like in my life? How am I tapping in to those protective factors, to those healthy coping strategies, to good regulation skills? And that, when adults are well, we will create healthier environments in the schools that we teach. And so that's a big part of that as well. And again, really focusing on how do we create that positive social norming. And this next slide really just kind of illustrates that concept of social network theory. And that's just this idea that things can spread through a social network. And we all understand this pretty intuitively when we think about, say, a disease process. We learned that in very painful clarity during the COVID pandemic, that a disease process can spread through a network. And what we've learned, though, is that attitudes and behaviors and beliefs, they spread through networks in really similar ways. And we see this, and talk about this a lot with maybe negative behaviors. So when we think about smoking behavior, binge drinking behavior, or drunk driving behavior, we can see how these things can kind of spread through a social network. But what we've learned is that positive things spread through a network in the same way. Things like resiliency and healthy coping strategies and connection and help-seeking attitudes and hope, these things spread through a network in the same way as well. And so we're not training peer leaders to be junior psychologists, to like pull up a couch outside of their locker and start fixing all of their friends, but rather to be connectors to help when they see somebody who's struggling, and to be agents of social change, that they really become the patient zero of an epidemic of health, of a contagion of strength within their school and community. And that's a big part of what we're fostering. And we can probably skip through these next couple slides, but just illustrates that these are social network models from some of our randomized control trials that we've done, where we really are analyzing this kind of at a scientific level to see how behavior change happens across a high school, how these norms spread and shift, and really looking at in a lot of different ways. And so I won't dig into too much of the kind of nuance of those slides, but a part of that idea of social network theory is a huge part of what makes Sources of Strength work, is that it's not just kind of a one-off medical model, but it's actually much more of a public health model about how we create this at a community level. And so this is some of the research that is really exciting for us to be sharing and to talking about right now. Sources of Strength, as I mentioned before, has become one of the most rigorously evaluated and widely disseminated prevention programs in the country. And we now have several different randomized control trials published in really prestigious journals showing these results. And so way back in 2010, Source of Strength was the first program to ever show that you can use peer leaders to change those population level health norms associated with reducing suicide risk. So increasing connectedness and protective factors and help seeking norms and all of those things that we've been talking about. And then in 2023, there was an article published in the Journal of Injury Prevention that combined 3 different randomized controlled trials spanning over a decade, spanning over 40,000 years of student years of exposure to the sources of strength intervention, which is a really rare sample size. And we measure suicide deaths in deaths per 100,000. And so it's really hard to get a large enough sample size to actually look at suicide death rates and mortality rates. And by combining these studies, they were able to do just that. And what we saw is a little above the national average suicide rate in our control school conditions. And we saw no suicide deaths in the intervention condition. And we know that sources of strength doesn't prevent all suicide. Like, again, it's not an inoculation, but it was really encouraging results. And it was the first RCT to ever show a universal intervention reducing youth suicide mortality. A really big, significant finding for the field, and one where the study authors argued for implementing this intervention at scale as one of the tools in our tool belt as a country to actually move the needle on kind of the suicide and mental health crisis that we're having and the rising rates that we've been experiencing over the last decades. And then we just in January of this year, we're published in the American Journal of Preventative Medicine on schools right here in Colorado, a study that showed a 29% reduction in the probability of new suicide attempts. And so again, a really significant findings showing that moving from kind of crisis intervention to including upstream strength-based prevention strategies really can be a life-saving model and have a population level preventative impact. And so some really encouraging data within the model there. And then you can go to that next slide. That kind of underscores the need and the vision to take a more public health approach. That in the past 50 years, we've reduced heart disease deaths in this country by over 60%, which is a really rare public health success story. And we didn't do that by just being better at performing heart surgery. We didn't do that by just getting better at, putting defibrillators in shopping malls and being more effective at intervening when somebody was having a cardiac arrest. We did that because we got healthier as a society in a lot of different ways. And so through smoking cessation, through putting calories on menus, through having a culture around exercise and paying attention to these things. And we need a similar kind of public health approach when it comes to mental health in our country. I think we tend to have culturally a conversation around mental health primarily through the lens of diagnosing, navigating, and treating mental illness, which is not the same as promoting and cultivating mental health. And so thinking about how are we at the individual, the communal, the cultural, societal level supporting conditions for better mental health and better well-being. And that's a big part of what we're trying to do at Sources of Strength. And you can go ahead and go to that next slide. One of my favorite quotes comes from this man, Gary Gunderson, who says, we spend a lot of time talking about the leading causes of death, but not nearly enough time focusing on the leading causes of life. And that's a big part of what we're trying to do at Sources of Strength is we're not trying to ignore or pretend that hard things aren't happening, but we are trying to focus on the conditions of a more well world. How do we create the things that help us heal, that help us be well, that help us be strong, that help us to be resilient? And it's a both and, of what are we doing to address some of the things that are creating chronic stress and that are detrimental to our well-being? And what are some of the ways we are cultivating the strength and the resilience and the capacity to navigate those things in a healthy way? Because life will life. Being a human can be difficult, and I think I'm a big advocate of we need to do a better job in our country of humanizing before we pathologize. That when we're talking about the anxiety and the fear that we might be feeling right now, when we're talking about the anger that we might be holding, the sadness and the grief that we might be navigating, these are human emotions. And we need to have conversations around what helps us walk through that in healthy ways. And that doesn't mean we're broken. That doesn't mean there's something wrong with us. And being able to have a conversation and normalize the things that help is, I think, a really crucial part of that. And that's kind of what this next slide is communicating is Sean Acor is a leading researcher on kind of happiness and on well-being out of Harvard. And he says the absence of disease is not health. We have to work towards health. And that's a big part of what we're doing at Sources of Strength, is really looking at how are we creating health individually, but also communally. And that is a big part of, I think the impact of Sources of Strength, like we talked about, those downstream outcomes. Certainly we're seeing, we have the evidence base that it's having an outcome on suicide, and we can see impact on things like substance use and violence, but also grade point average. And that it's a lot easier to focus on your science when you're not constantly in crisis, and there's a lot of elements of where we can have a benefit for students who maybe they would never become suicidal. Maybe they're never going to drop out of school. They're never going to commit a crime. They're never going to get addicted to drugs or alcohol, but they are stressed out. They are navigating some difficulty. And this can be a model that really helps those students as well. And so it has much more of that kind of universal outcome for everyone. It really can be that powerful impact. And so just a couple more slides here. So much of the model is built around these sources of strength. This is the sources of strength wheel, these 8 different protective factors. And the way that we develop this wheel is when we talk to people who had gone through difficulty, when we talk to people who had experienced whether their own suicidality or suicide attempts, or they'd experienced addiction, or they'd experienced violence or loss. And we ask them, how did you get through that? The things on this wheel were the things that they were describing. And we began to realize that this is what resiliency looks like. This is what recovery looks like. This is what living a healthy life can look like. And so a lot of the work at Sources of Strength is focused and centered around promoting and cultivating these protective factors, these sources of strength. And that within each of these, we're trying to have a really expansive view of what that can look like, and not being too prescriptive, but really letting an individual and a community find themselves within this model. And so that all of these can be really protective for us. And there's lots of different ways that people might experience those strengths. There's lots of different ways that those strengths might show up. But there's a lot of evidence around each of these protective factors about how they're really helpful for both our thriving, but also when we go through difficult times, these are the things that help us get through. And so much of the model is focused on building that. And this is our elementary wheel. And so it's those same strengths and really focusing, a lot of the elementary curriculum. We have a unit on emotion regulation, like how are we navigating when we're feeling big emotions, some basic like brain and body science, like what's going on in our brain when we're feeling those big emotions. And then a unit on each of these different strengths of thinking about what do these strengths look like in our lives? How do we cultivate them? What are proactive ways we're caring for these? What are reactive ways we're caring for these when we're going through something? And so much of the model really focusing on cultivating, building up these protective factors at both, again, the individual and communal level. And then just kind of to close here, looking at the, you can go one more slide over. There's this story about the architect who won the bid to build the Brooklyn Bridge, this iconic bridge between New York, Manhattan, and Brooklyn. And the story goes that, they were under construction on this bridge for just years and years and years, and there's no visible sign of progress. It's kind of like when you're driving by 100 miles of traffic cones and you're like, can we give the cone guy a bulldozer? Maybe we can get a road built. And so the people of Manhattan, the people of Brooklyn, like kind of call this town hall essentially to fire this builder. And he comes to try to save his job. And he says, the reason that you don't have a bridge is because we've spent years building below the waterline. And it is only as a result of that work that this bridge is going to stand the test of time. And I think about that story, and I think about how often we can feel that, as parents, as educators, as folks working in mental health, where we look around at the end of a school year and we say, where's my bridge? Is this working? And I think it's really important for us to remember um, that working in education is building below the waterline. Working with young people is building below the waterline. Working on mental health and public health is building below the waterline. It's foundational work. And it's only as a result of that work that we'll build bridges that stand the test of time. And I think it's such a core thing for us to remember how valuable it is to do that essential work. And then I think also as a reminder for us in our own lives, and that would be my encouragement to all of you today, is also to be thinking about how are you building below the waterline in your own life, that you're taking care of yourself as well, because we need you here, standing the test of time to do this good work. So I'll close there, and I've left plenty of time. I finished a couple minutes early, so I've left plenty of time for any Q&A, and happy to discuss any elements around this, whether it's what the program looks like in schools, around our research or evidence base, or some of the philosophy and kind of things around the founding of sources of strength, whatever might be most helpful for you all. Thanks.
Thank you, Scott. That was amazing. So much good information. Like I said, this is one of my favorite programs that I get to utilize in our schools. So thank you for everything. We do have already 6 questions. If anyone has any additional questions, please drop it in the Q&A, but I'll go ahead and get started. So the first one is, if my kid's school doesn't have this program, how can I get them involved? And before I turn this over to Scott, I do want to say that if your kid is in a DPS school, please reach out to me. I will be sending out a follow-up email. We have grant funding that we can bring sources of strength to your kid's school. But if you're not in DPS, I will turn it over to Scott.
Yeah, I think a great place to start would be reaching out to our team. If you go to that last slide there, Leah, it has, I think, some contact information. So you can go to sourcesofstrength.org, and there's a form right on our website that you can fill out and get connected in with our team, and we'd be happy to answer any questions that you might have. See if we do maybe have the program in your kid's school or not, or help to be able to move it in that direction. So I think that would be a great place to start. Here in Colorado, we're fortunate, we have great district partners throughout the state. Also, the Colorado Attorney General's office has supported and funded Sources of Strength for several years through 2 different Attorney General administrations. We have strong support from the state health department and Office of Suicide Prevention. And so we are working to continue to create opportunities for schools to implement Sources of Strength if they're not, and to make that accessible for schools. And so hopefully we could help get that going and get that connected. Or if it's a school that maybe has it and your student's not involved, we could maybe get you connected in. And a lot of times we would be working, if they're in DPS, we'd be working with Leah and her team to help support that at the local level.
Thank you. So the next question is, sometimes our students really want to take on the junior psychologist role. How do we encourage them to be connectors instead of fixers, even after the training?
Yeah. I think I think it's a nuanced thing, in that there is a lot of validity around like a peer helper model, that a lot of times students would rather talk to a peer than talk to an adult. And peers can be really helpful in helping people navigate some of those things. And so I think we don't want to give the message that you can't be a helper, that they have a lot to offer. And I think one of the things that we hope we can equip students with Sources of Strength is some better messaging, some better tools around how to support people and how to help people, versus some of the other things that might be out there on TikTok and whatnot around, how can we talk around the wheel? And somebody, if I've got a friend who's saying, hey, they're really overwhelmed and they're experiencing this thing, like, let's talk about what strengths do you have? Let's talk about what's going on. And that can be really valuable. But we also really want to equip students who are not feeling like they're having to carry that burden on their own, especially if it's something where we feel like there's there's heightened risk, right? Where somebody is feeling suicidal, or where somebody is maybe experiencing abuse or violence, and or they're experiencing addiction, like those. We want to connect people in and wrap people around with support. And so it's not to say you can't be a part of that support, but that we don't want you to be the only part of that support. And so sometimes we think about that wheel, the source of the strength wheel, as like a net, and if I fell and that net was only tethered in one place, it doesn't have nearly as much ability to catch me when I fall. But if it's tethered in multiple places, it has a lot more ability to catch me and to be a support. And so it's that idea of like a web of support is much stronger than a single thread. And so helping, and I think students understand that. And they care about their friends, they care about their peers. And so being able to have those conversations and talk about that hesitancy of like, hey, they don't want me to tell anybody. Like that's an uncomfortable position to be in. Let's talk about that. And let's talk about that proactively so that students also understand how to kind of walk that help seeking pathway when that happens. And so I think that's a big part of what we're trying to do in Sources of Strength is exactly that, to establish that culture, to have those conversations, to be able to address those things, because it's real. It's not hypothetical to our students that they're experiencing these things. They're having friends that are going through things, and so being able to really equip them with some tools in that, but also to be able to help them see how that broader network of support is a really critical thing, especially when it comes to something like suicide. And we just know how important that it really is, that we're tapping into a network of support, and we're not trying to be the only person. I do this for a living. I don't intervene with suicidal people on my own. That it is about wrapping supports around it for folks. And so I think that's a really important question. And I think it's an important conversation for us to have with our students as well.
Thank you. Okay, so the next one, and I can tell this was asked by somebody who does sources of strength in their school, and I'm also curious, what are some of your favorite campaigns that you have seen schools do?
Oh man, that's a that's a good question. Part of what I love about Sources of Strength is that it's not like overly prescriptive or boxed. That we do have like templated campaigns that schools can do, but a big part of the model is really leaning into that local expertise and insight, and what works in one school might not work in another school. And so it's really cool to see the ideas that students come up with, and the ways that they do that. So some of my favorite campaigns, I'm trying to think, there's so many really cool ones. We've seen a lot of really fun campaigns around build like trusted adults, and really trying to kind of increase that normalization of connection and trust towards adults. We know that that's a significant protective factor. And I always want to also talk about trusted and trustworthy adults, right? Like it's one thing for us to work to get students to trust adults. It's another thing to be adults who are worthy of that trust. And we got to have both sides of that equation. And what are we doing as educators, as parents, as adults in the community to be trustworthy? And again, I think that network of trusted adults is more protective than a single person. But we've seen a lot of really cool campaigns where students are naming who they would go to, and writing them a note, and that increases this like help seeking pathway of saying, hey, I named you as somebody I would go to if I had a friend I was worried about. It drastically increases the likelihood that they'll actually go and talk to that person in the event that they have a friend that they're worried about. And so we've seen cool campaigns where it's like Dress Like Your Trusted Adult Day. So students come to school, dressed like their science teacher, and it's often very hilarious. And so, there's just little things like that are cool. We've had schools do like fun runs where they have this like big activity, and at they have stations like geared around the different strengths on the wheel. We've had schools do like wellness days. We have had schools do community events where they're inviting the parents in, and they're saying, we had one school that they did like a session on, I think it was like a parent thing on like youth mental health, or suicide prevention or something like that, and like nobody came. And then they rebranded the exact same thing on like advice for parenting teenagers from teenagers, and everybody came. And it was students talking to their adults and talking to their parents about what they're experiencing and what is helpful for them when they're experiencing it. And so again, these are all like locally generated ideas that students have. And then we also, try to really support through like parameters around, we talk about safe messaging. So making sure that that's like hope, help, strength based messaging, and kind of that targeted messaging of trying to move beyond just having people be a passive like audience member of like seeing a campaign, but actually being a participant within it. And the thing that moves the needle is like when I can say, this is what that looks like in my life, and I can apply that to my life, it is far more likely to like sink in and to stay with me than if I just, see the campaign on the wall or hear about it. And so really trying to get students to think about how are you inviting people in to those campaigns. And we've seen some really cool things around beginning of the school year, and freshman orientation, and like ways that we can help cultivate belonging and help people feel seen and not feel isolated. And so, yeah, like that's not a very clean answer. There's because we have now thousands of schools across the country implementing sources of strength, and tens of thousands of different campaigns and activities, and really some powerful innovative stuff that we're seeing happen.
Thank you for sharing. Okay, so next question. What change or impact have you seen on your peer leaders or on peer leaders? Do you get feedback from adults about what it's like for them to be part of the program? So, two-part question.
Yeah. There's a lot there. I think what we've seen, there's what we've seen through like our research where we're seeing increases in connectedness, increases in belonging, increases in um, school engagement, um, and then certainly like those prevention outcomes are really powerful. But then we're also seeing just like in conversation with students when we come back and we're in a year 2 or a year 4 school, and students are, one of the questions we often ask is like, hey, how's this wheel changed for you? Have you gotten stronger in any of these areas? And it's really powerful to hear a student say, when I was a freshman, here's what I was going through, and I didn't feel like I belonged, and I was really struggling with my mental health, and and then they tell these stories of tapping into their strengths and finding their voice and finding a sense of belonging and connection. And it's really powerful to hear. We had um, a school board meeting in a school in Idaho where they were looking at adopting our elementary model. They'd been implementing our secondary model for some time. And there was a school board meeting, kind of a community hearing, trying to decide if they were going to adopt this. And a student came and gave testimony at the school board meeting, and he was visibly terrified to present at this meeting. And he told this beautiful story. But he talked about how he never really felt like he belonged. He never really felt like he had friends. He never really felt like he mattered um, until he joined Sources of Strength. And he found a voice, and he found friends, and he found purpose, and he found that he had a lot of strength. Um, and he said, if I had had this when I was in elementary school, it would have saved me 4 years of wanting to die. Sorry, I always get choked up when I tell that story, but I think that's the impact that we're having, and that students are having for one another, and that the adults that are holding space and creating and doing this work are having in their schools. Um, that it's meaningful and it's profound, and it is saving lives, but it's also saving people that loneliness and that lostness, and having a sense of connection and of purpose and of belonging and of strength and of hope. Man, it's a powerful thing, and so I'm really proud to be a part of that.
That's really powerful. Thank you for sharing.
Yeah.
Um, okay, next question. I worry about today's youth. Lack of connection, loneliness, exposure on social media to violence, etc. Can you talk about how Sources combats this for youth?
Yeah, I think those first couple are definitely ones that we engage in a lot, like lack of connection, um, and belonging, and how are we really leveraging um, impact in those places, and so really inviting students into thinking about how are they cultivating and creating uh, schools and systems and places where people feel seen, feel heard, feel valued, feel cared for. And there's a lot of different ways we can do that. And so there's campaigns that we're doing around like belongingness campaigns, um, and a lot of different ways that we're trying to get students and adults to like think creatively about how they do just that. Um, I think social media and kind of violence in our culture, they're trickier issues. But I think part of what we're trying to do is like create a space where we can have those conversations, and create a space and a culture where we're being a little bit more mindful and intentional around the things that serve us and help us to be well, and the things that don't. Um, and and I think we're seeing students lead a lot of that, where they're recognizing this thing isn't actually helping me. This thing isn't actually serving me. Like maybe I'm entertained by it, but I feel awful afterwards. Or I feel isolated, or I feel, and leaning into like having those conversations and talking about those things. And I think, when we're talking about those strengths, we're talking about those protective factors. Um, a lot of them are tapping us into some of the things that are outside of our phone, and it's not that our phone can't be a tool. Um, but it's maybe not the best thing to be like driving our life, right? And so I think the way I would answer that is probably we're creating a larger space to like hold that conversation and explore that together, because I think we've learned that it doesn't work very well for adults to come in and say you shouldn't be doing this, you should be doing this. But it is pretty effective for us to explore those things together, around what helps us and what is serving us and not serving us. And like, and I think students can really be a powerful voice for that kind of change. And again, like this is happening like at a culture level, at a norm level. And so it's not me that's changing youth culture. It's teenagers, and so being able to invite them into that conversation, that exploration, and help them tap into when they experience some of those strengths of like how they're helpful, then they go and become advocates for that amongst their peers. And I think that's a big part of what creates the change. But I think just holding the conversation and being able to be open about what are we getting out of that, what are we not getting out of that, I think creates space for us to maybe have a better imagination for what a better way might look like.
Last question, unless we get any last minute questions in the Q&A, is as parents, how should we be talking with our kids at home about this?
Yeah, great question. I think that Sources of Strength wheel is a great place to start. You can pull it off of our website, um, and we have on our website, we also have a document that's like practicing strength at home that has some different activities and things that you can do. But I think sometimes it's, having maybe some of that more strength-based conversation where it's, not just all about the risk, but it's talking about, hey, what's helping you? And so I think we can use that wheel and talk around each area and how that's bringing strength for folks. We can also leave that a little. One of the questions we often ask people is like, hey, which of these strengths are you feeling strong in right now? What's one of these that you'd want to work on? And being able to kind of engage in that conversation and that dialogue. um, so I think there's a lot of different ways that we can talk about that. I think, especially when we're navigating change, when we're navigating like transitions, when students are going into a new school, or maybe they've gotten in trouble and they're coming back to school, that wheel can be a really helpful thing to be thinking about, navigating that transition of like, hey, which of these things are helping us? Which of these things You know, if we're coming, you think about moving to a new community, like that whole wheel kind of gets thrown into flex. Or we think about students that are graduating and they're going to college. All of those protective factors are changing. Let's have a proactive conversation around what do these look like in your new context, right? And so I think that's a really powerful thing for parents to be having those conversations. Like if we've got a graduating senior, or maybe we got a fifth grader going into middle school, like talking to them about how do they tap into those strengths in this kind of new space. I think that proactive work can be a really powerful kind of preventative thing. And then one thing that popped into my mind is the Jefferson County Communities That Care. They put together a resource called 12 Talks to Have with Teens. So you might just Google that, 12 Talks to Have with Teens. Sources of Strength is one of those talks. And so they have kind of a whole scripted out thing around talking to your student around sources of strength, but then they also have several other conversations and topics that's important for adults and students to be talking about. And I think that's a big part of it, is like removing some of the taboo and distance of like, we can talk about these things and we should be talking about these things, and then naming it, I think, is a really powerful part of being able to explore the things that help us through it.
Amazing. Well, awesome. Well, Scott, thank you so much. First of all, thank you to both you and all the participants for hanging on with us as we deal with all the tech issues that still are coming about in this world. And then thank you for sharing all of this information with us. Thank you for everything that you do. Um, and yeah, and I encourage everyone to follow Sources of Strength on all of the socials and reach out if you have any questions.
Thank you so much for having me. Appreciate it, everybody.